Hello, everybody. I'm Steve Kurtz. I'm the current chair of the CE Task Force for PCIT International, and the following presentation is one in a series of presentations we call CE to Go, and these are mini presentations of key articles in the PCIT literature. We hope you enjoy.
This was a study done by also an FIU group, Dan Bagner's group at FIU, Heymann, Heflin, and Bagner are the authors. And they looked at the effect of therapist coaching statements on parenting skills in a brief parenting intervention for infants. And they looked at language differences here too. So they wanted to look at and examine the effect of PCIT therapist coaching statements on parent skills in an infant sample, and then look at the differences among Spanish speaking and English speaking parents and therapists. So just quickly, some things to highlight with their rationale here. Therapeutic alliance we know is a predictor of treatment outcome, but a lot of measurement of alliance is biased, right? We're asking therapists directly and parents directly, what do you think of your alliance? And that can obviously, for obvious reasons, be fairly biased. And so we need more objective measures, which would be coaching statements and, specifically looking at parent skills. That might be another indicator of alliance and an outcome and improvement in treatment. So what the literature says, but even before this article that came out, is that directive coaching is negatively associated with parental use of labeled praise. And so directive coaching, I had to remind myself too, so I put it here, prompting, modeling, direct commands, indirect commands, drills, and exercises. And responsive coaching, which is praises, constructive criticism, reflective descriptions, process comments, are associated with higher use of labeled praise and then higher treatment completion rates, which is pretty powerful connection there. Previous studies mostly look at, as a lot of the literature out there does, predominantly white English speaking samples. But we know that the studies done in Latino families look a little bit different. Skill acquisition takes a little longer. We see less verbal approval, slightly more negative statements like commands during play. And no study to date has examined therapist statements comparing these two different language groups. Okay, I'm just gonna skip through some of this. We had 24 parent infant dyads, 12 to 15 months old, mean 14 months, participating in infant PCIT, Spanish or English speaking. 50% of caregivers report living in poverty, 91% identify as Hispanic or Latino, 42% of the babies were male. And the intervention was a home-based adaptation of PCIT for high-risk infants. So they had up to 7 weekly 1-hour sessions, including an initial teach session. And all therapists were doctoral students in clinical psychology. 50%, so exactly half of treatment sessions, were conducted in Spanish by native Spanish-speaking therapists. They looked at responsive coaching statements, directive coaching statements, parent skills via DPICs. So getting into some of their results, they found that there was an effect of therapist responsive coaching statements on parenting do skills. So the higher rates of responsive coaching led to higher proportion of parenting do skills at the very next session. That's how they measured it. They didn't find any significant effect overall of directive coaching statements on do skills, although they did show that specifically the higher rates of indirect commands from the therapist led to lower do skills. Higher rates of therapist praise led to a higher proportion of parenting do skills. But responsive coaching and directive coaching didn't predict the proportion of don't skills, sorry. And in terms of the results, in terms of the language difference results, we see that English speaking therapists use a higher rate of responsive coaching statements, praises, and direct commands, but that there was no significant moderating effect of language on the association. So it didn't matter in terms of the effect on responsive versus directive coaching. There's no significant moderating effect of language on the association between individual therapist coaching statements and parenting do or don't skills. So overall, we see that therapists' responsive coaching during the first coaching session predicted an increased rate in positive parenting skills in the next session. Increased use of praise from the therapist led to increased rate of positive parenting skills. That's probably no surprise to us. that finding, and just highlights the importance of therapists' use of positive social reinforcement and responsive coaching. We did see therapists' use of indirect commands associated with lower do skills, so it makes sense that we need to continue to train our therapists, sort of shape them away from using indirect commands. That was a finding that they have here. Importance of therapists following the parent's lead, which is more responsive. Importance of modeling therapist to parent and PCIT, and indicates that responsive coaching definitely should be used in the first couple of sessions, and that's sort of a practice that we already follow. And in terms of the language results here, they found that Spanish-speaking therapists used fewer responsive coaching statements, praises, and direct commands, but the effect of coaching statements on parenting skill acquisition didn't differ based on language. So the the guideline here is that training therapists, in regards to training therapists, it should be the same among Spanish and English speakers. Some obvious limitations of the study: small sample, short time interval. So there's no follow-up here, no no bidirectionality looked at, and it's not a randomized trial. Some questions that I have in terms of application to practice is, what's the mechanism of action here? Why does therapist behavior impact parenting behavior? We know the importance of modeling for our parents, but what's the mechanism here? And I didn't delve into this research too much myself, but I am curious also about more of the, instead of just looking at it face value of, oh, Spanish speaking therapists use less of certain skills. I'm curious why, and what those sort of cultural differences are. I think that's an important factor to understand. And I had just sort of started reading, after I read this article about Ghana, the PCIT adaptation for Mexican American families, and what the differences are, and the rationale and theory behind the adjustments, and and why that is. So I do wish I learned more about this article. Didn't really talk about those cultural differences, so I'm